Good afternoon, everyone, and thank you for joining us today. My name is Storm Gray with the Council on Foundations. Welcome to our webinar, Striving for Work and Overcoming Barriers, the 2015 National Employment and Disability Survey. Before we get started and I hand it over to my colleague, Stephanie Powers, I wanted to go over with you a couple of housekeeping tips that will better assist you in having a great experience on our webinar for today. Should you have any issues during the duration of this call, please feel free to click on the Help Desk option in your toolbar at the top of your navigation panel. We'll be taking questions from you all throughout the duration of the call. Please utilize the questions or chat box, and we'll get those questions coming into us, and we will turn around and shoot those back to our presenters so that way they can address your questions. And in the event that we do not get to all of your questions, please know that we will follow up with you post-webinar. And in order to exit the webinar, you'll just click the X in the upper right corner. And thank you for joining us today. And with that, I'm going to hand it over to Stephanie Powers to introduce the rest of our panel.
Thank you, Storm, very much. And good afternoon, everyone. Thank you for being with us today. Storm, I'm just going to ask you, can you hear me all right? Because I am remotely joining this session.
I can hear you perfectly, yes.
Oh, very good. Thank you. And I'd like to do a special welcome to any council members who are participating today or any of their grantees. As the webinar invitation stated, the nation is recognizing the 25th anniversary of the passage of the Americans with Disabilities Act this month. The Council on Foundations believes this legislation has been and continues to be an important cornerstone of our nation's civil rights guarantee to millions of people with disabilities who live and work among us. Today's presentation will show you the important progress that has been made in achieving a fully inclusive society with full parity for our citizens with disabilities. But you will also conclude, I think, after listening to our guest presenters, that there is still a lot of work yet to be done. The Council has made an organizational commitment to collaborate with some of our members at the Council and other cross-sector partners to take a look at how people with disabilities are participating in the philanthropy sector. For example, we have added new demographic questions to our annual member salary and benefits survey because we would like to create a better baseline about the presence and participation of people with disabilities on foundation staffs and boards of trustees. We currently co-host a cross-sector thought leadership community called the Lansdowne Group, and we do that with the Association of University Centers on Disability and the U.S. Business Leadership Network, as well as with the Chicago Community Trust and the New York Community Trust. We also would like to explore grant-making strategies that foundations are using and to learn more about their inclusion approaches in their grant-making strategies. And we hope to continue creating a climate for a continuing and growing discourse across philanthropy about the challenges people with disabilities encounter in their goal to achieve full inclusion, both in our sector as well as generally in society. So today's webinar will launch a conversation about the employment status of people with disabilities. And I would like to thank the Kessler Foundation for today's learning program and for sharing their research as well as making their researchers available for this conversation. So I'd like to now introduce Elaine Katz, who is Kessler's Senior Vice President for Grants and Communications, who will start the program. And I'd like to welcome Dr. John O'Neill, Kessler's Director of Employment and Disability Research, and Dr. Andrew Houghtonville, who is the Research Director of the Institute on Disability at the University of New Hampshire. Elaine, would you like to get us started?
Thanks, Stephanie. I'd also like to welcome everybody to our webinar as well. We hope that as we share the results of our 2015 Kessler Foundation National Employment and Disability Survey with all of you this afternoon, this information will provide a better understanding of how people with disabilities view their path to success in the workplace, which likely will improve outcomes of the projects that support job creation and economic development in our local communities. For those of you who are unfamiliar with Kessler Foundation, we're a global leader in rehabilitation research that seeks to improve cognition, mobility, and long-term outcomes for people with disabilities. We lead the nation in funding programs that expand employment opportunities and lead the way in linking science and grant making so that people with disabilities can be more productive and independent. Over the past 10 years, Kessler Foundation has invested more than $32 million through our grant programs to become a leading funder of innovative approaches to the persistently high rate of unemployment among people with disabilities. Our signature employment grants are all collaborative models in which we leverage dollars to encourage organizations to pursue promising approaches and concepts beyond what they may have done without our support. We hope that by leveraging our dollars and human capital through these partnerships, it will stimulate new ideas from the field that will be models for policy change. As we approach the marking of the 25th anniversary of the signing of the Americans with Disabilities, Kessler Foundation really wanted to make a significant contribution that would be relevant for years to come. So last year, we awarded a signature grant to the University of New Hampshire to conduct the survey that you'll be hearing about in a few minutes. It was important to us that this survey be designed as nationally representative, scientifically rigorous, and transparent means of exploring the experience of Americans with disabilities and helping them find and maintain employment. We also wanted to make sure that the researchers have continued access to the raw data for future disability employment studies. The survey targeted 3,000 households in all 50 states that included at least one person aged 18 to 64 with a disability or health condition. Unlike other employment surveys, the Kessler survey highlights successes in finding and maintaining employment rather than the challenges of facing barriers to the workplace and the employment gap between people with and without disabilities. It's our hope that this survey will be a reliable source of information that will inform researchers, grant makers, and policymakers towards the development of effective strategies for promoting long-term and meaningful employment opportunities for people with disabilities. We also hope that the survey will influence other grant makers who focus on jobs and poverty issues, but are not focused on employment of people with disabilities in their grant making. Next Sunday, as we celebrate the 25th anniversary of the Americans with Disabilities Act, the first comprehensive civil rights law addressing the needs of people with disabilities, prohibiting discrimination in employment, public services, accommodations, and telecommunications. In celebrating and in planning for the next 25 years, let us all look to solutions that promote the economic advancement of all Americans. What I'd like to do now is turn it over to Andrew Houghtonville, who's going to continue our discussion about the survey and some of its background. Andrew?
All right, so one of the things that we want to do is give you all a background on the population with disabilities. Why don't we go to the next slide? All right, so before we get into the results of the survey specifically, I wanted to give you a flavor of who people with disabilities are, kind of the challenges facing them, and maybe show that the populations that your foundation, that your organization is interested in, includes many people with disabilities as well. So what you see on the first slide, these are Census Bureau's figures from the American Community Survey. Many of you may be familiar with the American Community Survey. It's the relatively new survey that the Census Bureau is doing to get better local statistics. So if you see state level or county level statistics these days, they're usually out of American Community Survey that the Census Bureau does. So typically these results show that the population with disabilities is around 19% of the population. All right? So about 1 in 5 people in the U.S. has a disability. And I'll talk a little bit about how disability is defined a bit later. About 20% of women and 17% of men report having a disability. So women typically exhibit more disability. Part of that is age-related because women are more likely to live longer, and disability is related to age. Ethnicity, the population that are white alone non-Hispanic and black alone non-Hispanic. Those are Census Bureau terms. Around 20%, 1 in 5 for both of those populations. The Asian alone non-Hispanic and the Hispanic population typically exhibit much lower prevalence rates of around 13%. Around 13% of those populations report having a disability. And so disability is a pretty big part of the population. If you think about the population, African-American population, Hispanic population overall in the United States, the population with disabilities is a bit bigger than the Hispanic population overall and the African-American population overall in the United States. So the population with disabilities is a diverse population. Let's go to the next slide. This is the age comment. So disability is related to age. So children 15 years and under, around 8% report having a disability, or their family reports them having a disability. And I mean, you can see that that rate steadily increases, so that by the time it's ages 85 and over, 71% report disability. Right? But many programs in the United States, typically the way programs work in the U.S. is treating people above and below 65 differently. There are some very big programs for people with disabilities in the U.S. Certainly there's special education programs for those age 21 and under. And then when there's, during adulthood, there's the Social Security Disability Insurance Program. There's the Supplemental Security Income Program, which is an anti-poverty program available to working age people with disabilities. Medicaid and Medicare are available to many people with disabilities who are on the Social Security programs. And also there's the vocational rehabilitation program for people working who are under age 65 as well. Next slide. So one of the things that to keep in mind as you think about the population with disabilities, and also as you think about the population in poverty, is that the poverty rate is nearly double, sometimes triple, depending on the survey and source, among the population with disabilities. So this slide shows 15 persons ages 15 to 64. 25% of people with disabilities in that age range report income below poverty levels. That's compared to 14% for people without disabilities. So a little less than twice as high a poverty rate among people with disabilities. When the same is true when you go over age 65, that people with disabilities are much more likely to be in poverty than people without disabilities. Next slide. So this slide shows the share of the population. So if your foundation or your organization is looking at poverty as a key indicator or key population to consider, this is for the population ages 25 to 64 in the U.S. If you take the people in poverty, 25%, basically about 25%, have a disability. So 1 in 5 people, if you're working with the population that are struggling with poverty, about 1 in 4 will have a disability. And in fact, some of the leading researchers in the area of poverty, the poverty institutes that are funded by the National Academy and the National Institutes of Health, disability is becoming a much bigger part of their portfolio of interest. If you remember the welfare reform, many of the people that were left unable to transition out of welfare during the transition from AFDC to TANF, many of those individuals were people with disabilities that weren't able to get onto the Social Security rolls. And so there's a long history of disability playing a big role in welfare programs. Next slide. And so this is 65 plus. So 65 plus, the share of people in poverty, nearly around two-thirds has a disability if they're in poverty for those who are above age 65. Next slide. So this brings us to one of the big topics that leads us to the survey that the Kessler Foundation has put forward that we'll be talking about in more detail later. So this is persons ages 21 to 64. So the population without disabilities, it's around 80%. For people with disabilities, it's around 40%. So the employment gap is around 40 percentage points, right? So, you know, about half the employment rate. So the percentage of people who are working is much lower within the population with disabilities than the population without disabilities. And not surprisingly, that's going to be related to the poverty rate as well. Next slide. Can we do the next slide? Yeah, so median earnings. So if you take wages and salaries of people who are working, again, people with disabilities are in jobs that are paid far less than people without disabilities. And so, you know, any challenge, any program that's going to go after, say, the working poor has to consider the fact that many of the people who they may be working with have a disability as well. Next slide. So before we go into this slide, let me just, can we back up to the slide before? Thanks. I don't want you guys to get ahead and read ahead to what John's going to be presenting next. One thing to consider is, as we look at the ADA anniversary coming up, is how are we working, how are we going to define disability? There is a large heterogeneity, a large diversity even within the population with disabilities. So there's disability type, so there's mental conditions and physical conditions. There's sensory conditions. The population with people with disabilities is quite diverse, not just on age, race, gender, the traditional diversity categories, but also within the population by disability type. And so what the ADA does, and many of the agencies, it's not defined by a specific condition, right? It's not defined by a medical condition. It's defined by the limitation of activities. And so the ADA is defined as the limitation of activities, significant limitation in activities. And you know, the ADA is not just, you know, there are employment provisions with the ADA, there's housing, there's access to public areas. The ADA has a lot of different things, employment being one of them. But you shouldn't really, well, in my opinion, the ADA is not really a law that's designed to boost employment as much as it say that people with disabilities have the right to be adequately accommodated within the workplace. And so it's more of a civil rights bill than it is a jobs bill, right? And I think that that's an important thing to think about as we look to the ADA anniversary. One of the things that's happened with the case law and also the ADA Amendments Act is that you don't necessarily have to have a limitation that's active. It could be mitigated by, say, medication or rehabilitation or devices. And so people who can do activities even with the assistance of devices or, say, medication still are considered to have a disability with the ADA. The Census Bureau does ask a set of questions to identify the population with disabilities. Depending on the survey that they're fielding, it can be anywhere from 6 to 60 questions used to define disability. And you know, disability is defined not with medical terms, but with functional terms like vision. Can you see? Can you hear? Do you have difficulty going up and down stairs? Do you have difficulty doing activities? And so because there's more of a movement away from medically defining disability and defining it as the ability to function, that's one key issue that you might want to be aware of. So John's going to talk a little bit about the national trends, another effort that Kessler has to track national trends in employment, and then we're going to jump into the survey that Kessler Foundation fielded. So John, go ahead and take it away.
Okay, thank you, Andrew. Next slide, please. As Andrew mentioned, the Kessler Foundation, in collaboration with the University of New Hampshire, produces a report on the employment situation of individuals with disabilities every first Friday of the month, that coincides with the jobs report that comes out from the Bureau of Labor Statistics, and we refer to our report as the National Trends in Disability Employment. What we essentially do is we take the Bureau of Labor Statistics data and we customize it in order to look at individuals with disabilities versus individuals without disabilities on a number of key factors. One of the key indicators that we look at that the BLS produces is the employment to population ratio, which reflects the percent of people who are working relative to the total population. And we've been doing this for 2 years now, and in 2014 we did a summary of those reports over the calendar year. And we noted that persons without disabilities during that period experienced an average increase of 1.4% change in the employment to population ratio, whereas the picture was not positive for individuals with disabilities who experienced an average decrease of 3% over that year in the employment to population ratio. Most recently, however, we've seen some progress being made by individuals with disabilities. Over the last 8 months, the employment to population ratio for individuals with disabilities has outpaced, in terms of its increase, has outpaced folks with disabilities have outpaced those without. The average increase over the last 8 months has been 10% for persons with disabilities and only 1% for persons without disabilities. So it looks like there may be a trend. One caveat, though, is the disparity between the overall percent of people with employed. The disparity remains between those with and without disabilities. Andrew, I think I'll hand it back to you to begin our presentation on the Kessler survey.
Okay, thanks, John. So next slide. So one of the things we wanted to do is we both the Kessler Foundation, UNH, and many of the researchers in this area, a lot of the news, the way that things are cast are in terms of disparity, right? Poverty, disparity, earnings, wage gaps, things like that. And over the years, we've gotten many comments about, well, there are many people with disabilities that are working, right? What can we learn about their success? It's not just a story of dependence or use of welfare programs. There's actually a positive story out there. And with the passage of the ADA and the expectation, a changing expectation of one from, a safety net to one of expecting people to work. What's going on? And so we really wanted to change, from a story of disparities to a story of what are people with disabilities doing to strive to work, because they are people working. Not necessarily just focus on the barriers they're facing, but what about their success in overcoming barriers, right? So we'll hear all the time, well, number one barrier is transportation. Another barrier is, attitudes of individuals like supervisors and coworkers, but not about, okay, did you overcome those? And then what did you do to overcome those barriers? So we really wanted to change the discourse around disability. Also, we wanted to inform the designs of new interventions and priorities. So, Kessler is the leading funder of employment grants for people with disabilities among foundations, and also doing leading research of their own. What are some new priorities and new directions that could be developed to go after the barriers that are perhaps least likely to overcome, or to leverage barriers that are more easily overcome, and we could do even a better job there. So where are areas that we want to address? The other is there was a real information gap. There really is no nationally representative, credible statistics. We hear a lot of anecdotal statistics about the workplace experience of people with disabilities, but we know whether they're employed on a national level. We have lots of great statistics coming out of the Census Bureau, Bureau of Labor Statistics, Center for Disease Control, lots of great statistics, but nothing about the actual workplace experience or the actual barriers faced and success in overcoming barriers. So we wanted to fill that gap. Why don't we go to the next slide? All right, so the one thing we did was, we're focusing on employment. We focused on people ages 18 to 64. We had to identify the population with disabilities. We didn't survey people without disabilities. We really wanted to focus very, very closely on the experience of people with disabilities in the workplace. So we used some questions from the Census Bureau's American Community Survey so that we could do comparability comparisons. We also added some questions from the Canadian Survey on Disability, which had some richer questions. We identified people with sensory, physical, and mental conditions and developmental disabilities. All were interviewed. We did give the option for a proxy interviewer to be used for those who couldn't complete the survey on themselves. Next slide. It was a sample telephone survey. We had a 3,000 plus sample size in order to get precise enough estimates so that we could say things. Sample size, all statistics are a guess. The more information you have, the better guesses you can make. And a sample size of this size allows us to make more accurate guesses, more accurate estimates of what's going on. We used a random digit dial approach of both landlines and cell phones. We also randomly selected, if there were more than one person with a disability in that household, we selected one person from that household. The interviews were conducted October 2014 to April 2015 by the UNH Survey Center and the Penn State Survey Research Center, both of which are have leading survey shops within them. Next slide. So the result was we had around 19% of all households complete the survey. We used some statistical techniques to reweight the data to make sure that we were representative. So we used similar approaches used by the Census Bureau to make sure that we weren't, say, having more older folks or more younger folks, depending on who answered the phone. We wanted to recalibrate using sample weights, and that's a common approach. Next slide. I think we're going to get the results next. All right, so I'm going to turn it over to John, and he's going to describe the results of the survey.
Okay. The results of the survey that I'm presenting today is really just a subset of the results. There are more extensive reports on the Kessler Foundation website. But today I'm going to focus on striving to work and the kinds of measures that we looked at, the kinds of questions we asked in order to get at this issue of striving to work. I'm also going to comment or present some of the results around the barriers that people experienced as they were looking for work and the barriers that they experienced while they were on the job, and in both of those situations we'll also focus on some results around overcoming those barriers. So Starting with striving for work, obviously those individuals who are working are striving to work, and that was about almost 43%. And then we also asked those who were not working whether they were looking for work, and that increased the proportion of folks striving for work to about a little over 51%. And finally, we asked workers who were not working if they had worked post the onset of their disability at any time between that and the survey. And that increased the proportion of folks who are striving to work to about a little over 68%. So this is a different conceptualization. We're often looking at those who are working versus people with disabilities who are working versus those who don't have disabilities, and therein lies a big disparity, of course. But we often don't look at those who are looking for work, and particularly those we have not conceptualized the striving in terms of those who have worked since the onset of their disability. Okay, next slide, please. We also asked some questions around hours worked, and we found that amongst those who were working, they were working an average of 35 hours a week. And there was about 61% of those folks who were working more than 40 hours per week. Those two statistics alone belie the notion that, well, people with disabilities are only working part-time because that's all they can handle. We also asked whether people who were working, whether they wanted more hours, and about 41% of those folks said they wanted more hours. So I think these are clear indicators of individuals with disabilities striving to work. Next slide. This particular slide focuses on overcoming barriers or barriers in the job search process. And there were three barriers. The three barriers that people faced that were the most frequent were not having enough education or training, employers assuming they couldn't do the job, and lack of transportation. And so that, not having enough education, about 41% indicated they felt they didn't have enough education. About 36% felt that employers assumed they couldn't do the job, and about 27% felt they had a lack of transportation. But if you look at the far right column, large proportions, relatively large proportions of folks who were facing those barriers felt they had overcome them. Looking at the barrier that was least likely to be overcome was being denied health insurance and work-related benefits. Only 16% felt they had overcome that barrier. And in terms of another barrier that was the most likely to be overcome was the family discouraging the individual from working. About 63% of those who felt that their family had been discouraging them to work about 63% felt they had overcome that barrier. Next slide. Barriers at work and the overcoming of those barriers. The three barriers that were the most frequently faced by individuals on the work site was getting less pay than others in a similar job, negative attitudes on the part of supervisors, and negative attitudes on the part of coworkers. Here, folks were overcoming those barriers or felt they had overcome those barriers slightly more frequently than the barriers in the looking for work. Those getting less pay, about 39% of those who faced that barrier felt they had overcome it. About 41% of those facing negative attitudes of supervisors felt they had overcome that barrier. And negative attitudes on the part of coworkers, about 54% felt they had overcome that barrier. As with looking for work, family members discouraging folks from working, it was a relatively low percentage of folks felt they had faced that barrier. But amongst those who had faced that particular barrier, about 64% felt they had overcome it. Next slide, please. So the key takeaways, I think, from this this brief presentation of the results is that we found that work is very important to people with disabilities, and they show it in the many ways that and the many things they are doing to search for jobs, prepare for employment, and overcome barriers. In terms of searching for jobs, and this was not in the slides, but folks are using a number of different strategies in terms of searching for jobs. They're looking for and applying for jobs online. About 77%, about 68% are using family and relatives to look for work, and about 61% are contacting employers directly. The use of the more formal agency, government-related help in terms of looking for work, the proportions of folks using those entities is pretty much less than 25%. Which I think is revealing. In terms of preparing for employment, amongst those who are not working, as you would expect, about 73% are obtaining medical treatment or rehabilitation, and about 63% are getting help from family and friends. And then the proportions kind of go down a little bit. Those that are going to school or getting college, it's about 47%. So folks are doing quite a bit in terms of preparing for employment, even if they're not employed. And I think the other takeaway is that people with disabilities are striving to work. They are working, they are preparing for work, they are looking for work, and they are working post-onset of their disability. And finally, many are successfully overcoming the barriers that they face when looking for work or in the workplace. We will be conducting further research on the how, not only whether people successfully overcame the barriers, but how they overcame those barriers. And we'll be looking at that barrier by barrier. And Elaine, I think I hand it over to you now.
Okay, thanks, John. Next slide, please. what we're going to be doing for the next few minutes is sharing with you a few of the Kessler Foundation projects that tie back directly to our survey findings. Although these projects were funded before the survey began and we did our research, all the projects are currently in year 2 of funding, and the survey results continue to support the ideas behind these grants. So in our first example, which you see on your screen, putting face to work model, relates back to our survey fact in that 68% of individuals with disabilities relied on informal networks such as family and friends to help look for jobs. And if you think about it, it's the way many of us look and find for jobs through our friends and family. So when the idea came to us of using social capital and networks within religious congregations to help a person with a disability find a job, we were very intrigued. We funded the first pilot in Minnesota about 1.5 years ago, and last year we awarded a 2-year signature grant to Vanderbilt University. And they expanded the project to 3 other states, so right now it's in Kentucky, Tennessee, and Texas, in addition to Minnesota. On the screen you see the slide that gives you a breakdown of how the project works. I'm not going to go through it because you kind of can look at it. It's really to give you a broad idea of how the project works in a global sense. So it's primarily a volunteer-driven project. It's coordinated by the University Centers on Excellence in Developmental Disabilities, the UCES, if you're familiar with that. Each state is working within 5 to 10 different faith-based congregations in various denominations to help approximately 15 people per state. Many are using either current ministries in congregations that may also focus on disability or employment, while others are using existing social action models. Each state model is slightly different, so not only are we in 3 states, but we're testing 3 different variations in the model. Our target is to connect with at least 60 people with jobs during the 2-year project and develop a manual that can be customized that any faith group could use that would like to start a similar initiative. So we're really excited about the model since it's volunteer-driven and low cost. As of June of this year, the grant was working with 51 people. 11 have secured part-time employment and 9 have secured full-time jobs. And as I said, the project is ongoing. Next slide. This project is our career College to Careers Bridging the Gap program. And this is a project that's aimed at increasing the number of college students with disabilities making successful career transition. It uses a collaborative approach to provide both skills and support. Our survey found that a little over 47% of non-working job seekers prepare for work by going to college or school. And as some of you may know, college graduates with disabilities have much more difficulty finding good jobs than their non-disabled peers. So this 2-year grant is led by San Diego State University in collaboration with California State University Fullerton and University of California, Berkeley. This slide shows you the breakdown of really the different partners and how they intersect. The other partners are PolicyWorks, which provides the project management, the California Department of Rehabilitation, and the U.S. Business Leadership Network, which has affiliates in San Diego, Orange County, and Silicon Valley. The USBLN is a business-to-business network that promotes employment of people with disabilities. Next slide, please. So this slide right here is showing you the major components of the program. The program is anchored by a college credit course, which uses the Professional Development and Disabilities curriculum that was developed by Paul Hippolytus, who's the Director of Disabled Students at UC Berkeley. The course is offered in online modules with an online instructor guide as well that enables each campus to tailor the course content to a variety of formats. In addition to the curriculum, the model connects students with peer and career mentors, and this team assists students in making connections for internships and employment opportunities. Next slide, please. This slide really provides, again, and I'm not going to go through the whole thing as you can look at it, but it's a more detailed view of how the program works at each school site. So the model provides wraparound supports to the students in the course, providing career plan evaluation services, peer and career mentoring, career-oriented experiences, internships. The The success of the first-year operation in California was pretty impressive. Students reported that this was a life-changing course. When we looked at pre- and post-survey identification, it identified that students reported a significant shift in attitudes about their ability to be competitive in the marketplace, their value to an employer, also their confidence levels. At this point in time, there's been 109 students who've gone through the program. There's been 36 placements with our May and June graduates still in current job searches, so I'm sure the numbers will go up. The placement also includes 11 full-time jobs, 15 part-time jobs, and 10 internships and volunteer positions. So this particular program has had lots and lots of interest because it's one of the few programs that is centered around actually a college credit course in addition to all the supports that are provided. And we're looking at the foundation of further expansion in California and also replications of the models right now in New Jersey and Florida. Can I have the next slide, please? So the next program I want to talk to you is about the Pepsi Act Together, or Achieving Change Together. So this is a very collaborative project. Kessler Foundation has joined with Poses Family Foundation, Autism Speaks, New York Collaborates for Autism. We're in year 2 of an expanded disability initiative, which actually it was PepsiCo that named it Achieving Change Together Act. The funders are investing about $1 million, and that's matched by a similar amount by PepsiCo. We have a nonprofit partner that's based in Bethel, Connecticut, which is Ability Beyond. So this initiative was started well before Section 503 regulations were approved and implemented. Simply stated, for Pepsi, it really made good business sense to invest in quality, a diverse workforce that would help Pepsi reach its business targets. This project supports the survey in that people with disabilities are striving to work, and those who are currently employed are working an average, as John said, of 35.5 hours, with a little over 40% wanting to work even more hours. So the idea for Pepsi Act was formed following an internal study conducted on disability employment. Pepsi's goal was to create a universal, accessible career experience for all job seekers and hire 2,000 individuals with disabilities over the next 5 years. However, they also wanted to go really fast, and they wanted to go really deep in their operation. As you can see from all the business components on the slide, this was really all these components put together was the evidence that really convinced Pepsi to move ahead with this initiative. Next slide, please. It's important to note that this project has the support of most senior leadership at Pepsi Beverage and includes frequent reporting to the CEO. Pepsi had an initial pilot in Minnesota, and this was quickly expanded last year to include new centers in Houston and Las Vegas. Earlier this year, a new call center in Winston-Salem, North Carolina opened, and most recently a new partner site opened in Phoenix, with Nashville, Tennessee, and Orlando soon to follow. The goal for Pepsi is to launch ACT sites in all the PepsiCo regions, and as you can see, the sites all vary in whether or not they may be a production site, they may be a distribution site, there's a certified repair center, there's a call center. The call center handles sales as well as inbound repair. So very different operations, sometimes in the different regions. It's all, I know everybody may have heard a lot about the corporate distribution center with Walgreens. This project includes a number of different sites besides distribution centers. The Ability Beyond team has provided Pepsi leadership with the supports for the project. I'm not going to go into all the details of the project, but the idea is to go into communities, develop local public-private partnerships, and the idea is to get in with the supports from the project team, help a local launch site get up and running, and then with Pepsi eventually carrying the ball. The project team has already exited Minnesota, and North Carolina has just also become self-sufficient. Next slide, please. So as you can see from the results from May of this year, 75 individuals started working, 58 have been remaining in their positions, and the key for Pepsi here is the retention rate. So 77% of individuals hired under this project have been retained, compared to 64%, which is Pepsi's retention rate and national average. So this, again, is a convincing reason for Pepsi to continue with this project. Not only retention, but their return on investment. They're saving money because employee turnover is reduced. We're recently seeing cost savings in the hiring process as well. So for them, it's a win-win situation. It's been a win-win, great collaboration between all the partners, funding partners, and also the business team. What I'd like to do now is turn it back over to Andrew for information on customized statistics, and he's also going to wrap it up.
All right, thanks. Thank you, Elaine. So one of the things that I'm an economist by training, and I love using large national surveys, and having the opportunity to conduct the survey with the Kessler Foundation was a great opportunity to recraft, what's our statement? Reshape the dialogue around the employment of people with disabilities. And you know, if many of you are not focused primarily on disability at all, or have other groups that you know your organization focuses on, statistics are a powerful way of, you know, a powerful form of dialogue. And one of the things that we have availability to do through some of our funding agencies, from our grant funding, is to customize and provide statistics. So if any of you on the call are interested in having statistics for your own population, but particularly for the population with disabilities, that maybe in your state or maybe in your area of interest, maybe you're looking at education, if you're interested in education statistics by disability status, you know, we'd be happy to talk with you about what's available, and then if we're able to do it, to generate some tables for you. We have access not only to what you can find on the Census Bureau website, but we have access to the raw data, so we can cut the data in many different ways. And so one of the things I wanted to do today is offer that to the people on the call, because we do get paid to provide technical assistance to others with regard to the use of statistics. Also, if you're interested in seeing the Kessler survey, the Kessler Employment Survey that John talked about, those results. John mentioned that there are additional reports and things on the Kessler website, but we're also continuing to do research using that data, and we're hoping to continue to expand the survey itself. You can actually take the survey if you're interested on links from the Kessler website. We have an online version of the survey. But if you're interested in some information from the survey, we certainly have the data available to us, and we can work with you to maybe conduct some interesting crosstabs or things like that. So I'll turn it over to Q&A to Stephanie and those at the Council of Foundations. And again, I appreciate the opportunity to talk with you all.
Thank you very much. Storm, I'm just checking. Can you hear me?
Yes, we can hear you just fine.
All right, very good. All right, great. This is Stephanie, everyone. So were there questions, maybe, Storm, that came in through the chat box, or should I mine them right out from the participants who are on the phone?
I think it'd be a good idea. We haven't gotten any questions from the group yet, but for our participants who are listening, if you have any questions that you would like to ask of our panelists and speakers, please do so using the Q&A or the chat box on your screen. We'd be more than happy to answer any questions that you may have.
Great. And I have several questions that I can sort of get started with, things that kind of popped up for me, and probably questions for all three of them. So maybe I'll just kind of pop down through the ones that I have. I was kind of interested. I think, John, you were the one who was talking about the data about the faced obstacles and then the overcome obstacles. And one question I had about those charts, in that overcome column, are the overcome percentages a percentage of the faced number or of the total universe in the survey? I wasn't quite clear.
It's the proportion of those who faced that particular barrier.
Oh, all right. Okay.
Yeah.
All right.
Yeah.
Okay.
So even when you have a pretty good number of those who faced a barrier, overcame it, most of those numbers, as I recall, were relatively well under 50% of those who actually had said they had barriers because they were trying and striving to work. So it's while there's good news in there, there's a lot of other news about the fact that a lot of people either aren't striving, feel they can't, there's barriers, or even thinking about that. So I think there's a lot of work to be done there for a lot of stakeholders in this, certainly, and probably takeaways for foundations, I think, in that. And I did hear you say, I think you or Andrew said, on the takeaway slide, the key takeaways, that you're going to be exploring more around how they are overcoming those barriers. Did you get any indication or any examples that you could share with us about how they might have overcome those barriers?
Right. Well, we did. Andrew can piggyback upon me, but we did ask an open-ended question. If someone indicated they had overcome a particular barrier, we did ask an open-ended question as to how they had overcome the barrier. And we do have those quotes, and we have yet to do a content analysis.
Okay.
It's a big job,
Sure.
but that will be forthcoming.
Yeah, sure.
We also intend. We asked everyone who took the survey if they would be willing for us to come back to them at a later point in time. And about 2/3 of the participants said they would. And so we have begun conversations about how, about the fact that we will return, and the kinds of probing questions that we'll want to ask to add meat to the bare bones in terms of how people overcame their barriers, but also for those who didn't, what was the nature of that particular barrier for them.
Right, okay. You know, I'm wondering, one of the things I'd like to turn this conversation just a little bit, given that we are the Council on Foundations, and as the Council, we are trying to grow the conversation about who's working in the philanthropy sector. There is not very good data about the numbers of people who actually are on staff or who are on boards of trustees, and you know we are you know a relatively significant sector if you add the nonprofit sector. Certainly, you know, with the foundation sector, you know, the data that we've heard over the last few years is that we hold 10% of the labor market jobs. So it's a pretty significant number. But the data about the presence of people with disabilities, you know, in that 10% who are working in the sector is pretty thin. I've had many conversations with Kelly Brown from the D5 Coalition that many funders who are on the call will probably recognize. The D5 Coalition has been working on really exploring the diversity and inclusion issues for lots of different populations in the foundation sector itself. So, you know, we're sort of feeling that we've got some work to do to really take a look at our own sector and how are we contributing employment opportunities for people with disabilities. So having said that, I'd like to sort of throw this out for anybody's comments, maybe you researchers and Elaine, you might want to comment on this. But you know, what do you feel sort of what are the implications for funders as employers and recruiters of boards of directors? You know, how can we as a sector maybe contribute or make a little better effort to really get more people into jobs in the foundation sector? And anybody on the phone, if you would just identify yourself and you'd like to throw an idea out or a comment out about that, please feel free to do so.
This is Elaine. I'll take a first stab at that. I think if you look, when you talk about disability, the first symbol of disability is what everybody thinks of when they look at a parking sign, which is a wheelchair. But I think to the point that Andrew made earlier, especially as we're looking at the 25th anniversary of the Americans with Disabilities, disability has gone definition well beyond physical disability. There's many people with what they call either non-evident or hidden disabilities. But disability now, and employers can include many things that when the ADA came through, made it easier for somebody with a disability to engage in work. For example, if you're a diabetic and you need to have a break to take insulin shots during the day, that's considered being protected under the Americans with Disabilities Act, under the ADA. However, if you talk to most people who have diabetes, they would not consider themselves as having a disability. So I think when you look at the broader sense of 1 in 5 individuals in the United States probably falling into disability, you're looking at probably more a non-obvious disability. I think when you talk to foundations who both have employees and work in our communities, I said just acknowledging and being aware of the fact that there are people with disabilities who are working for them who may not want to acknowledge it for one reason or another. Their projects have people with disabilities that do affect results. It is an important first step, and making an environment that's welcoming to all people, and that when you look at diversity, it's not just your traditional groups, but it does include people with disabilities. I'll let somebody else comment if they'd like to run with that.
Yeah, thanks.
This is Andrew. So one thing that foundations and a lot of employers, that many times there are many people with disabilities that are not currently working, and having the ability to do internships and engage in the workforce, to take the steps to engage in the workforce, to get training, to get some resume items. I'm almost looking at it I'm a college professor, and what do I tell my students? Build your resume, build your resume, build your resume, and because it's a signal. I have a 16-year-old daughter. Well, maybe you should get a job at another place too, so that you have 2 employers that have said, okay, you're a good employee, that you're able to do things appropriately. I think foundations, they always seem to be a source of internships, mostly unpaid internships, but I see students doing it all the time, and I think that taking that approach with people with disabilities and reaching out to, say, vocational rehabilitation organizations and developing relationships where you can have paid or unpaid internships to give people experience in the labor market would be a great help, because as an economist, it's all about signaling that you're a quality employee. Having experience like internships is a great way that students do it all the time, and that opportunity should be afforded to people with disabilities.
This is Stephanie. Yeah, I think that's actually a very good suggestion. Internships are relatively common across the philanthropy sector, providing those opportunities for mostly, post-secondary students. But I mean, you could do some adaptation for students, secondary school students, to give them some, experiences over the summer, for instance. But I think that that's something that's kind of doable, that we might take on and maybe do a little bit more work in the sector to inform the sector about how to do that, find where the best practice is around that, and share that more widely across our sector. I will say this, at our annual conference that we had in April in San Francisco, I conducted a series of focus groups with attendees, about 40 to 50 foundations over the 2 days, really talking about our sector and just kind of exploring and probing, what people's awareness levels are, and do you know how many people with disabilities are on your staff, and do you recruit people purposefully? Do you have purposeful statements? Well, nobody purposely discriminates. We have lots of statements or values that we're very inclusive, et cetera, but our numbers don't sort of, show up necessarily. Self-identification, as Elaine was saying, is kind of an issue, and it's an issue, certainly across the board. But I do think that where a lot of foundations, senior executives told us in April that they hadn't really thought consciously about their recruitment strategies, including people with disabilities. They weren't thinking that they shouldn't, but they hadn't really sort of thought, with real intent and purpose, like, oh my goodness, we should really try to recruit some people with disabilities or get them in the candidate pool. But, overall was a very sort of accepting idea. So we need, as a community, to make better connections with where, the pipelines are. And so I wonder if maybe Andrew, you or John or Elaine might want to comment about where might those pipelines be for foundations to tap into. I know, Andrew, you were talking about internships, so universities might be one place. Other thoughts about that?
This is John. One thought about the pipeline within the context of post-secondary settings. Oftentimes the career offices are not well integrated with the office that serves individuals with disabilities within the post-secondary setting. So one might be well advised to not only connect with the career office within a post-secondary setting, but also the office that serves students with disabilities.
Yeah.
With regard to secondary students, certainly any guidance office. I worked for a company years and years ago, and they hired many people with disabilities, both in permanent positions and internship positions. And they had a direct connection to the high school.
Right.
Students who might not be headed down the college route, what opportunities at the firm. And they actually, it was really neat because they took that over from the previous main employer that went bankrupt in the 70s, and they took over that role.
Yes, and I think that we've learned from our diversity work in the foundation sector too, with other target populations, is that a greater presence of the more diverse your staff is, the greater presence of some of these population groups on our staff begins to certainly affect the way that we develop strategy and the way that we carry out grant making as well. So it's got positive rippling effects, I think, through the way that foundations do their business, and ultimately, with grantees and the way that grantees do business, et cetera. So we begin to contribute positively to maybe helping people with aspirations to work to realize that. So are there any other comments, thoughts, questions from the audience that anyone would like to contribute before we sign off here? We're getting to the end of our time. All right, well, hearing none then, I think I'll wrap this up. Elaine and John and Andrew, I want to thank you very much for this information. We look forward to the next piece of information and the next analysis that you do, particularly around how people are overcoming those barriers. And I would like to invite any of the funders on the phone who are interested in joining the cross-sector thought leadership group that we co-host, the Lansdowne group, to please get in touch directly with me. And also, if there are any stories or examples that you would like to share with us as we're pulling together kind of the lay of the land, if you will, in the foundation sector about your approaches in grant making and board and staff recruitment, I would be delighted to hear those. So I'd like to thank everybody again for being on the call, and Storm, thank you for your management of this webinar, and wish you all a very happy rest of the day.